I don't know what this is, and I don't know why, but Rocky has like this lump going on right here. Taking my doggy in today. Hey Rocky. Hi Rocky.
So we're just looking at this little lump that Rocky has on his right flank. I'm also feeling on the left side because we want to look for symmetry. There's nothing on the left side. This feels perfectly smooth and normal. We're feeling down here to see if he's having any problems with his lymph nodes. Nope, that's fine. The lymph nodes are not enlarged down there. So now I'm kind of feeling underneath here to see if it feels like this is kind of attached to the underlying structures. It kind of moves around a little bit underneath my fingers. Doesn't appear to be extremely painful, but a dog like Rocky probably isn't going to show a lot of pain. These labs tend to be very stoic. Feels kind of soft, like there might be some fluid inside. So what I'd like to do is just clip a little bit of this fur and then pop a needle in there and see what kind of fluid we get out, okay? So that could be that he's developing a little abscess there. If he had a scratch or like the tip of a plant or a thorn that broke off in there, something like that, can certainly cause this type of lump, okay? So let's take a little sample of that and see what we have inside, and then that'll help us decide what we're going to do with it, okay? Is that okay, Rocky? Okay. So let me borrow him for a few minutes. We'll tap that and we'll see what we get in there. So we have good news. What this is an abscess, okay? An abscess, it does mean that we're going to have to put him under anesthesia to get that cleaned up, open it up and drain it. But the good news is that it's not a tumor or anything like that. He just has an abscess that we need to take care of. Now, what would happen, say if we didn't do this, is that that lump is going to continue to get larger, and then eventually it's going to break open, make a big mess, make a big infection right there. But if we knock him out for probably like 15-20 minutes, and then open that up so that I can clean it and drain it. Now this is the fluid that's inside, okay? And what that is it's a type of pus. So it's fluid with a little bit of red blood cells and white blood cells in it, okay? And this is what's going to accumulate when you have an infection. So he probably has something in there, like the tip of a plant or something that's maybe broken off under the skin. Maybe he's playing rose bushes, anything that's maybe got some small little sharp thing that I think is broken off underneath the skin. And then the body reacts to it because it's got bacteria and creates this fluid pocket around it. And then eventually that skin gets devitalized and then it kind of breaks open because the body wants to try to get rid of it. So what we do is we put him under anesthesia, we clip up that whole area, prepare it for a little surgery, and then we open it, okay? And then I'm going to get all this fluid out, I'm going to clean it really well, I'm going to flush it with an antiseptic, and then we stitch it up and we put a little soft rubber tube in it. It's called a drain tube. And then what that does is it allows it to drain as it heals because we want it to heal from the inside out, okay? If I just tried draining it and then sewing it up, then that fluid might accumulate again. So we put that little drain tube in. It's a little messy. You're going to have something like this, maybe a little blood kind of dripping a little bit, so you don't want them like on the nice carpet and that sort of thing for about 3 days. We put one of those party hats on him, one of those cones, because we don't want him chewing on that tube and pulling it out, okay? So we leave that in for about 3 days. We keep him on antibiotics, we keep him on pain meds. It's probably not going to hurt him that much, but you know, I want to make sure he's comfortable. And then after about 3 days, we take that little tube out. It takes 2 seconds. We just cut the sutures and pull that out, and then that will seal over. And hopefully, then it's all going to heal over, and the fur will grow back, and you won't even be able to see that anything was there. Now, is it going to all turn out like that? Probably. But what if he has like a deep infection inside the skin or something that wants to sort of keep oozing or something like that? Well, that's why we're keeping on antibiotics. So he goes home for 2 weeks worth of antibiotics to try to help make sure that we get everything like on the inside and everything. Okay? Okay. So that's what we'd like to do for Rocky. Like I said, it's good news because even though it's a bit of a hassle, I think it's nothing really serious. It doesn't look like a tumor or anything like that. He just has a little abscess. So we're writing you up an estimate of everything we want to do today. We usually do like to run a few blood tests before we use the anesthetic just to make sure there's no surprises. Okay. We want to make sure that his liver and kidneys are in good working order. As long as they are, there's no reason why he wouldn't tolerate a gentle anesthetic. We get this all done. He goes home this afternoon, got his party hat on, got his little tube, medication at home, and he should be fine.
Okay. Oh man, I'm so glad it's not like a tumor or anything serious, you know? I mean, yeah, it's pretty serious. Well, it's not that serious. It could have been a lot worse, I'll just say that. But I am concerned about her. But yeah, I'm so glad it's just some fluid and some infection other than something like major So they quoted me for $800, $800 something dollars for surgery and anesthetics and all these like stuff and everything. And I don't think we're gonna be able to pay that. So I think I just bought some antibiotics. It was like, I think like $30 plus the visit. So I'm gonna give her that, and then I think just see how she does. See if that takes care of the infection or not. I don't know.